Hello, in this video, I'm going to be talking about your dignity during and after breast cancer and its treatment. Before I go on, I'd love to invite you to subscribe to our channel. If this topic interests you, we have topics on trust and we have topics on forgiveness and an awe walk and what is it good for. So there are all kinds of things related to this exact topic. And don't forget to go to Yerbba.com. That will get you your personalized report so you can learn more about the treatment options that may be offered to you. So what is dignity? Dignity is your inherent worth or value. You don't have to earn it. From the minute you're born and you're just a little baby, you have dignity, you have worth. Dignity is different from respect. Respect we have to earn. And oftentimes we hear dignity and respect together. You know, it's in workplace codes of conduct. But dignity is different. Dignity is your inherent value just by your being part of the human race, just because of your humanity. Everything right about you, everything wrong about you, all the mistakes that you've made, you still have dignity. And nobody has more or less dignity than another. So a lot of people hear dignity and they think of somebody with long white gloves and perfect hairdo and perfectly made up. That is a form of dignity called aristocratic dignity. And that's not what we're talking about here. This is just your inherent worth. So clearly your dignity is essential, right? It's part of who you are. And nobody has more or less than another. So the interesting thing about dignity is not only is it essential, but it's also really fragile and tender and vulnerable to harm. We can have our dignity bruised. We can have it violated. People can deny that we have dignity, which is our worth. So it's two things. It's both essential and it's vulnerable to harm. We can violate our own dignity, the way we treat our bodies, the way we lash out at other people. If we stay in an unsafe relationship, we're violating our dignity. If we avoid conflict, we can violate our own dignity. And we can also violate the dignity of others. And other people can violate our dignity without even meaning to, through carelessness or through policies. Their intention is not to violate dignity, but that's the outcome. So what does dignity actually look like? Dignity really means that we belong, that we're safe, that we're secure, that people listen to us and validate our experiences, that they recognize when we're trying and they recognize our contributions and our successes. They recognize our trying even when we don't succeed. They also acknowledge what we're going through. They say, that sounds hard, or that shouldn't have happened to you. Dignity also means we're given the benefit of the doubt. People don't always look for our ulterior motive. Dignity also means we have autonomy. We can make choices about our body and about our future, and that gives us hope. Dignity is also accountability, that people take responsibility for their mistakes and then work to fix it. Dignity also involves justice. So there are a lot of things involved in dignity, and all of these can be violated or can be honored. And as you're listening to this, maybe you're thinking about specific instances in your breast cancer experience in which your dignity has been honored, when somebody listened to you or validated you, who recognized that you were doing everything you could, who gave you privacy, who helped you feel safe. And it's also likely that you're thinking of times your dignity was violated. Maybe somebody said, well, you're lucky it's only stage 1 breast cancer, or you're lucky you don't need chemotherapy, which invalidates your own experience. So it violates understanding and acknowledgement. Or maybe somebody says, if you just try harder, this won't be so bad. They're not recognizing that you're doing the best you can. Or they make a decision for you. This is when people are overly helpful and they take away your autonomy to make your own choices or to spend your day the way you want to. Maybe you don't feel safe and secure. You know, a lot of things we do in medicine are violations of dignity. We talk about the indignities of being a patient with those gowns that open to the back, and our privacy is just plowed over. And we don't feel safe and secure. If somebody makes a mistake and they don't take accountability, that's a violation of dignity. I'm wondering, I'm curious if you're seeing your own experiences through this lens of dignity. And truth be told, it's also possible that you violated your own or somebody else's dignity throughout this experience. It's really hard to go through life without having our dignity violated or violating the dignity of somebody else. Okay, so we've talked about all the ways we can violate dignity. What happens when our dignity is violated? Well, we can feel it in our body, right? If somebody interrupts us when we're talking about something that matters, it's like a gut punch. Or we can freeze up, or we might lash out, we might feel hot and angry, or we might be afraid, or we might feel shame, that there's something wrong with us. Shame is actually the opposite of dignity. Shame tells us that we're a mistake. There's something so wrong with us, so broken with us. And dignity is your inherent worth, so you can see that there are opposites. We might also continue the cycle of harm. We might lash out at another person, or we might gossip about somebody. We might seek false dignity from other people. We might need constant reassurance because we've forgotten our own worth. We might outsource our dignity and have righteous indignation. Can you believe they said that? Can you believe she did that? I would never do that. When of course it's possible that we have actually done that same thing or in the same situation would do it. So there are a lot of things that happen, feelings we have, body responses, and then things we might act. We may also develop a grievance story. A grievance story is a story of harm in which we're the victim, where we tell over and over and over again the things that other people did to us, the things that went wrong, the diagnosis the doctor missed, or the way our ex treated us, or the way our mother treated us or didn't. We set up this grievance story. Interesting that grievance and grief are related. We're actually mourning something, but it comes out as a complaint and a story in which we get stuck. We get so stuck in this story. You know, we weren't meant to be victims. We can't thrive when we're victims. So this is one of the other things that happens when our dignity is violated. Okay, so I've talked about what dignity is and how it looks and all the ways it can be violated, the ways we might act or feel. What do we do other than the grievance story or lashing out? How can we reclaim our dignity? Well, a lot of the things I talked about, you can do the opposite of those. So for example, if righteous indignation is your go-to, and I'll be honest, that's my go-to strategy. I always say I would never do that, or often say that. For me and for others, it's helpful to realize actually I'm also human and I have flaws and I can work on being better tomorrow than I am today, and ask myself, have I actually done something like that to another person? So if somebody's invaded my privacy and I want to get all high and mighty about it, have I actually invaded somebody else's privacy? It's probably the case that I am. And there's something softening about realizing that we're all part of this flawed human race. Other things we can do if you've been gossiping about somebody is stop gossiping and seek true intimacy with a couple people where you can truly be yourself and you don't have to gossip to feel close. You know, a lot of us gossip because we want to connect with people. Did you hear this? Did you hear that? And it makes us feel connected to them, but it's not true intimacy. And if you have been telling this grievance story and sort of living in that victim state, one thing you can do is shift the story from all these things that were done to me to what can you do? What can you do to take agency instead of being the object of the story? This was done to me. What can you do to be the subject? I do, I choose, I am committed to what? So if somebody always interrupts you and you want to know, how do I reclaim my dignity after that? Well, you can certainly set boundaries. You can say, I notice that you interrupt me. This makes me feel bad because I like to be heard. I need to be heard. You can also pledge not to interrupt other people. You can also pledge not to do the very thing that people have done to you that you don't like. You can live in a way that is forward-looking and isn't backward-looking. You can be free from these stories. It's really hard to change the past. Check out our forgiveness video. We define forgiveness as giving up all hope of a better past. So you don't have to forgive. Dignity is essential. Forgiveness is optional. But some of the same tools in reclaiming your dignity are the same ones that can help you forgive and forgive yourself. So if you violated your own dignity, maybe you've done something that you're having a hard time forgiving yourself for, pledge to make a different future. Don't hear me as saying you've done anything wrong. We actually don't believe there's anything you've done to cause your breast cancer, but we do know that the breast cancer experience, having a diagnosis of and going through treatment, brings forth a whole host of dignity violations. Honestly, the number is I could go on and on with stories of dignity violations. The key is, what do you do now? Because living in the past is just suffering. What can you do to be free of that suffering? This is a heavy topic, I know. If you're interested, I have a podcast called The Dignity Lab. You'll hear conversations of people whose dignity was violated and ways in which they reclaim their dignity. You'll hear about dignity at work, in families, in the home, dignity in the environment, dignity in our communities. I'd love to have you subscribe. And don't forget to subscribe to this YouTube channel. Drop a comment or question below. We'll see you next time.